Assalamualaikum warahmatullahi wabarakatuh. My name is Zalza Nadia. So in this video, I will present about mammography that's supervised by Dr. J. Suman. So I will start with mammography history. It starts on 1913 that Albert Salomon, a German surgeon, published his monograph about using X-rays as medium to detect cancerous tissue of breast specimens. And then in 1949, a radiologist from Uruguay revitalized the interest in mammography and introduced technique of breast imaging. Then mammography continued to develop, and in 2010, mammography became the first logic 3D breast imaging technology. So what is mammography? Mammography is used primarily to detect and diagnose breast cancer and to evaluate palpable masses and non-palpable breast lesions. Mammography produces mammogram, which is images of breast resulting from radiographic units use X-ray and provide information about breast morphology, normal anatomy, and gross pathology. So mammography has two applications, which are screening and diagnostic. Screening is used for detecting unsuspected breast cancer earlier and screening of asymptomatic moment. And diagnostic is used for investigating symptomatic patients and diagnose unusual breast changes such as lump and pain. Mammography has three types. The first is digital mammography, called full-field digital mammography. It uses X-ray radiation to create image on the breast. So mammography also, of course, it has advantages and limitations. So the advantages: improve treatment of early disease, then reduce the risk of death due to breast cancers, and then optimize image displays and faster image production and patient throughput. And then for the limitation, mammography may has a radiation risk and also have a false positive rate up to 4% and false negative risk that not detect all breast cancer. And then it's not capable for pregnant women. So let's see the video about the mammography machine operation.
A mammogram is a picture of your breast taken with a safe, low-dose X-ray machine. Your technologist will ask you to stand facing the mammography machine and then place one breast at a time on a flat surface. Another flat surface, called a compression paddle, will gently be lowered into place to compress your breast. Compression is necessary to spread out the breast tissue and to eliminate motion, which may blur the image. The compression may be uncomfortable, but shouldn't hurt. Compression usually lasts no more than 20 to 30 seconds. During this time, an X-ray beam comes from above and penetrates your breast tissue. The X-ray image is either created on a film cassette located below your breast or recorded digitally and stored in a computer. Denser breast tissue, such as cancer or calcifications, appears bright and white, whereas less dense tissue, such as fat, appears dark or gray. After the X-ray is complete, the compression will release and the technologist will change the angle of the machine. Again, position your breast on the flat surface, gently lower the compression paddle, and take one more X-ray. Following the procedure, the images are processed and made available for review and interpretation by your doctor.
So how's mechanism of mammography machine operations? The first is patient breast is placed on flat support plate and compressed with parallel plate to have better quality picture and allow less radiation. The second is the machine takes X-rays and at lower doses pass through breast to detector. And then X-ray beam comes from above and penetrates the breast tissue. And then a pathographic film plate captures the X-ray image on film, transmit electronic to signal the computer. And then computer receives the electronic signals and then compress it to digital image. After the X-ray complete, the compressions will release and the technologies will change the angle of machine and do the same with the different angle. So and then a mammography has common problems, and of course there is a solution. The first is radiation exposure may cause cancer. The solution is produce high quality product with low radiation dose with intelligent synthesis of to the image. And then there is a cannot detect all possible cancer or false negative. The solution is upgrade the machine with movable compression pedal. And the last is difficult detection of lesions in women with breast implant. So the solution is use tomosynthesis imaging for clearer image and pseudo color display. The purchase considerations of mammographies are has recommendations for minimum performance requirements for film-based mammographic units, digital mammographic units, and mammography stereotactic biopsy system. And then developed by advanced grids, which are expensive but improve the image quality and meet the minimum MQSA requirements that including those for minimum tube outputs, compression performance, position controls, and reproducibility. And the last is the add-on systems attached to a standard mammographic radiographic unit, while dedicated prone tables are standalone devices. So the conclusion is mammography is an X-ray imaging to detect breast cancer and tumor that has two types of mammogram, which are digital, 3D, and conventional mammogram. And then mammography uses device with breast compression and support plate to screen to capture X-ray image. By this, my reflection is understand about mammography and its types and gain knowledge about its advantages, limitation, and how mammography is taken. That's all from me. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.